Out of the 100 types of cancer that affects humans the most, there are 10. They are bladder, breast, colorectal, kidney, and renal cell cancer or kidney cancer, lung cancer, pancreatic, prostate, skin cancer, uterine, and lymphoma. I will be concentrating on breast cancer. Starting with that one, breast cancer is one of the most common cancers primarily affecting women, but men can also develop it, and also there's a very small percentage, like a 1%, less than 1% in children. The overview of breast cancer: it develops from the breast tissue, and it's one of the most common cancers affecting women worldwide. It is the second most type of cancer affecting women. The first type is skin cancer. Though men can develop it, here is a detailed um, pathway about breast cancer. There's 5 different types. The invasive ductal carcinoma, or IDC, is the most common form. It starts in the milk ducts and can spread to nearby tissues. The second is the invasive lobular carcinoma, the ILC. It begins in the lobes, the glands that produce milk, and can also spread. There's the ductal carcinoma in situ. That's the DCIS. It's a non-invasive cancer where cells inside the ducts can change but haven't spread. The fourth is the lobular carcinoma in situ, and that's the LCIS. It's not a true breast cancer, but an indication of increased risk for developing breast cancer later. And the fifth type is the triple negative breast cancer. It lacks 3 common receptors, such as estrogen, progesterone, and the epidermal growth factor receptor, or the HER2, making it more challenging to treat. These risk factors can come from genetics, meaning your family history, especially mutations in your BRCA1 and your BRCA2 genes. That increases the risk. Your age, and breast cancer increases with age. It's most diagnosed occurred in women over the age of 50. Next would be hormonal factors: early menstruation, late menopause, and hormone replacement therapy can raise this risk as well. Your lifestyle factors: obesity, alcohol consumption, and smoking can also contribute. Symptoms to look for: a lump or mass in the breast, not always painful though. It changes in the size or shape of the breast. There could be skin changes within the breast, meaning like dimpling, puckering, or redness. You can have nipple discharge other than milk, um, or swollen lymph nodes under the arm. In order for it to be diagnosed, you can have a mammogram. Your doctor will order a mammogram. Um, it's an x-ray of the breast. Um, it's one of the key screening tools for sure. Also, an ultrasound can be done to evaluate breast abnormalities. And the biggest one is a biopsy, removing of cells and tissues for examination to confirm that it is cancer. Treatment options include surgery, and That surgery is a lumpectomy. It's a removal of the tumor and some surrounding tissue, or mastectomy. That's removal of one or both breasts. There's radiation therapy, often used after surgery to eliminate the remaining cancer cells. There's chemotherapy. It uses drugs to kill cancer cells, commonly used before surgery. There's hormone therapy. Hormone therapy is for cancers that are hormone receptor positive. They can block hormones that fuel the growth of cancer. And the last one is targeted therapy. This is known as, it targets certain characteristics of cancer cells, such as the HER2 positive cancers. Overall, the prognosis for breast cancer varies widely based on the stage, the type, your overall health, and response to treatment. Early detection is when you have a better outcome with this. You need to get regular screenings and awareness of changes. Um, there are support groups. Um, Worldwide, they provide education and the resources for breast cancer patients and their families. These include the American Cancer Society and breastcancer.org. There are local support cancer groups that you can research within your area. Um, 1 in 8 women, about 13%, um, will be diagnosed with breast cancer in their lifetime. Um, as far as breaking it down into ethnic and racial groups in the United States, Caucasian women have the highest incidental rates of breast cancer, with about 130.4 cases per 100,000 women. Black women, African American women, the incidental rate for black women is slightly lower than that of white women or Caucasian women. It's approximately 123.4 cases per 100,000 women, but they have higher mortality rates. Hispanic or Latino women have a lower incidental rate of about 92 cases per 100,000 cases compared to black and white women. Asian Pacific Islander women, they're around 84 cases per 100,000 women, and American Indian or Alaska Native American women is around 90 cases per 100,000 women. As far as what you can focus on overall, or what your loved one can focus on overall, is healthy vegetables, such as broccoli, cauliflower, kale, Brussels sprouts, leafy greens such as spinach, Swiss chard, collard greens, carrots, tomatoes, bell peppers. They are high in vitamin C. Healthy fruits such as berries, citrus fruits, apples, grapes, pomegranates. Your healthy herbs will be turmeric, ginger, garlic, green tea, parsley, and cilantro. And always remember to exercise: walking, strength training, yoga, swimming, Pilates. Stay hydrated and maintain a healthy weight. Also, consult with your professional healthcare provider, like your doctor or your registered dietitian. Have a good day.